order. And then I guess the first order of business then would be to approve the minutes. I have looked over the minutes. I did not see any problems. So unless somebody has an issue, can I have a motion to approve the minutes?
I'll make a motion that we approve.
I second.
All right. All in favor? Aye.
Aye.
Opposed?
Aye.
Okay. So we'll approve the minutes. All right. And then on to inspection reports. I think do we have a report from, is Rudy here today or who's here?
No, I'm here today.
Oh, okay, Charles. Okay. Do you have anything to report for us?
I don't have a lot. We're still extremely shorthanded. We've completed about 30 inspections. And we're in the process of updating. We were so far behind on everything from being shorthanded. There were so many health permits that were out of date that we're probably about 150 permits behind that I'm in the process of updating in the system so that we can get the reports put in.
So when you get a health permit, does that need to be renewed then every so many years?
It needs to be renewed, but that wasn't the problem. The problem was the amount of businesses that were being sold and not being able to keep up with the new owners being placed into the state system.
So every time a business changes owners, even if it's the same location, you need to go through the whole process from the start.
Yes, the whole process starts just like if it was a brand new business.
And are you behind mostly because of the increased workload or vacation schedules, or you need more people that are not, I mean, positions that need to be filled, or?
We had a
All
few
above.
things that had happened. We had somebody prepared to be moving into health inspector position. We were expecting things to get caught up at that point. And then somebody, due to physical limitations, was forced into early retirement. So we were
Okay.
unable to move the gentleman into the health inspector position when we had originally planned on doing so.
Okay, gotcha. All right, very good. All right, then the next topic that's on the agenda is lead abatement. We discussed that at pretty great length last week. I don't know if anybody has anything to add, or Mr. Henning, do you know of anything going on there that we can to discuss?
Nothing. No, nothing for lead abatement. No.
Yeah, we spoke quite a bit about that last week, what was going on and, how the process worked, and, they were trying to train more contractors, et cetera. So I don't know if there's anything more that we really need to talk about there. The next topic was opioid update. We had talked last time about, we were kind of getting tired about talking about COVID, although I just saw a headline today about how the admissions to the hospitals are up. So hopefully maybe we'll have to put that back on our agenda. But probably a bigger issue is the opioid problems in Berks County. So we had talked about trying to get updates on that. And Mike Sinitsky, I don't know whether it came out only a half an hour ago, so I don't know whether you've had a chance to see it, but Michelle can send it all to you. But it was just it was an update for our meeting, kind of telling us where things stood. And I have this in front of me, so I'll just hit a couple of the high points. In the period that he was reporting for, I guess over the last 6 months, the opioid issues were 12% of the total volume. So 12% of the calls that they take go out for are opioid. The overdoses continue to increase. And they went on to say how the Narcan is very effective and they save a lot of lives doing that, but they run into a lot of people who are using non-opiates, et cetera. And then also in here was, I didn't realize this, there's actually a medical director team for the EMR staff. And that's 3 doctors. They're all from Tower Health. I don't know any of them. Dr. Stauffer, Werner, and Rosen. And then they also just went on to include that they do ongoing CME kind of stuff, and about they have quizzes for the EMS people, and they all have to take a quiz to know how to read a 12 lead EKG and proper medical documentation, et cetera. So I think what we're going to see now going forward is reports that kind of tell us where we stand with that on a month-by-month basis. So it's interesting. I'll jump ahead for a second. About 3-4 weeks ago, I gave a report to City Council, which we're required to do every 2 or 3 years, just to let them know kind of what the board was up to. And I just covered kind of the main topics and what we were doing in the last 2 or 3 years from the last report. There was nothing earth-shaking that came out of that, although there were a lot of questions, hoping that we as the Board of Health might have answers to the epidemic, opioid epidemic. I said, yeah, if I had the answer for that, I wouldn't be standing here, you know. But I did share with them some, I mean, I've heard personally from EMS responders that one of the problems is you show up and you save these people's lives, and then you want to take them to the hospital, get detox treatment, et cetera. And then they say, nope, I don't want to go to the hospital. So that's a problem. And I don't know how you handle that. So I don't know if any of us had any brilliant ideas of how to turn this opioid crisis around. It's not so easy, but so we'll at least monitor and see where we are. Any comments on the opioid crisis or?
Well, I did attend that, I did attend that 1 hour session from the agency down in Florida that does the opioid training stuff, like the community stuff. And it was informative, but it was a lot of stuff in regard to advocating for funding. So it was a lot of like financial type stuff, like grant funding and different programs that are available. And I mean, that's just not my specific area where, you know, I come from. So it was more a macro level, but I think with COCA and the DA's office and the jail and all of the larger treatment providers we have in Berks County, I think we do make, in my opinion, relatively good use of the funding sources that are out there. I think that there are some gaps that might need to be filled in kind of service provision or harm reduction. But it really, that training, or I can't think of the word for it, but they really didn't kind of go into those two areas. So like I said, it was more just about securing streams of funding. So.
Well, if you could if throwing money at the problem would just solve it, I mean, a lot of this would be getting solved. I don't know. It's tough. So there are probably people who are walking. My own personal opinion is that there are people walking the street who aren't capable of taking care of themselves, and maybe they shouldn't be walking the streets. I mean, I know in the 70s they changed a lot of the rules about mental health care because, you know, it became much harder to institutionalize somebody against their will. But when people can't function, I don't know. Oh, well, okay. Moving on to old business. I don't think there's any, are there any reports today by the health literacy program? Not that I'm aware of, or are there? Dr. Bookins, or anything to report on that?
Yes, we have a few things. So I'll start and then Enid will conclude. But one thing, through the efforts of the grant, we have been able to partner with various organizations in their organizational assessment, looking at how they, the patients navigate their services, as well as their health materials, if they follow the class standards, if they're set at a 4th grade reading level. We also have worked with them in assessing the navigation, whether it was their particular office or their website. Some of the organizations we have partnered with who have gone through the assessment are now in the implementation stage are Berks Counseling Center, Faith Care, and the Berks Community Health Center. We've also partnered with, and when I say partnered, I'm saying we have an MOU with them that we're working with them with Tower Health, with Penn State 6th Street, and with the Reading Pharmacy down on Penn Street. So Penn State College of Medicine have created an organizational health literacy toolkit. If you can see that, you might not be able to because of my background. But with this, they have created this toolkit that gives many resources. So when they completed their assessment, they worked with an assessment tool called the HLQ, which is the Health Literacy. Let me tell you exactly.
Motion.
Yeah, somebody just said. All right,
Motion.
so yes, so they've worked with that. So with each area of the health literacy tool, we have created resources. Penn State College of Medicine has created resources specifically to align with those particular entities within that tool. We've also, and this the resources can be found under, they're going to be put on our website and made available for other institutions, health serving institutions that are located anywhere, actually, because our organization, our website can be used by anyone. So that's what we're doing right there on the organizational side. You need to talk a little bit more specific to a tool that we have created to combat misinformation.
Excuse me, one question. You mentioned on your website. What do you mean by your website? What website is that?
So the City of Reading Advancing Health Literacy.
Okay, so it's within the city of Reading. Okay.
Correct.
So if we
Sorry.
go on to the city of Reading and poke around, and you could find it there.
Yes, you'll find many links and resources on our webpage. Yes. Any other additional questions? And Enid is pulling it up right now to give you a preview of what it looks like and what you will be looking for.
Right, so to move into transitioning to my part of the report, this is the health literacy webpage for the city. It's super easy to find. If I just go back here, this is the homepage, correct? So you're just gonna scroll down here and you're gonna hit the Citizen Service tab. And then you're just going to scroll down to Community Development. We're the very last here.
Okay.
And this brings up our webpage. We have created a QR code that our grant is actively using in the community. In our last quarterly period, we have reached over, Caitlin knows the exact number, she just submitted our quarterly report to OMH, but we reached close to 5 million people with our ad, with our ads that we purchased with PPONS to do our reporting out of the vaccination efforts that we've had. And also we are the #1 visited webpage for the city of Reading. So the
Does the QR code take you to this webpage? Is that
Absolutely,
what the QR, where
yes.
does QR code directly?
All right, yes. Yeah, QR code directly links you to this page. So to understand the navigation, the multiple clicks can be a lot for some people. So QR codes are great for that. If you have a smart device, you can scan it and it puts you directly to this link. It'll show you this video, which we've shown before. It also has the COVID-19 county check. We are in the green. You can actively check this. These are all actively working widgets. You can put in your county here, and it lets you know that the threat for COVID-19 is low in Berks County, obviously. However, we also have links here to get COVID vaccination or boosters if you so seek that. And we also just recently updated, obviously our links to all of our social media pages are on here with a link to the minority health page for the CDC. And if you scroll to the bottom here, we have a direct link to our toolkit. This is a community misinformation guide. The community misinformation guide is being printed by a local business. And we're giving out some bags today at National Night Out with our QR code and a postcard to further engage the public to utilize this web resource, which is free. Our QR code is on it. It shows up like this because it's a booklet. So when you print this out, it'll print in booklet form. We created this with class and health literacy standards in mind. So everything is at a 4th grade reading level, meaning this is accessible in Spanish and in English. So we have all of the resources here. As you can see, this was a partnership with RAC, Penn State College of Medicine. So this is based off of the Surgeon General's misinformation toolkit. Bits and pieces of it, what would be relevant in my understanding, our understanding of the community, and bits and pieces of it were created with our community in mind. We have these local trusted community resources here. Most of these are either organizational partners or people who we have been working with in the past. A lot of this is geared towards talking about critical thinking, misinformation, disinformation, and allowing people to take control of where they gather their information and to critically think about where their health information is from, mainly. However, critical thinking is obviously diverse and doesn't necessarily only adhere to health misinformation. But for the purposes of our grant and our goals, this is centered around health. This is going to be live. It is live. It's a soft launch tonight. We're going to be working with various community organizations to do a teach the trainer essentially. So identifying people within these institutions, educating them on misinformation, and then tracking change of behavior through time. So going in once, doing a presentation, having that individual track change over time, coming back and reassessing the community to see if they have been thinking more critically of where they're getting their information and if this tool was useful for them. And we also have a video toolkit as well that's accessible via social media as well. Say someone doesn't want to download the toolkit or they just prefer to watch a smaller, more condensed version. It's more user-friendly for social media platforms for a user who's scrolling, because a lot of misinformation comes from social media. So we're trying to kind of engage people on a platform and where they would be engaging with disinformation or misinformation. So that's kind of where we're at with our misinformation campaign and all that fun stuff.
You've come a long way. You've gotten an awful lot done since the last report. None of that stuff did we know about. Looks like a good job. It'll be interesting, and you'll be able to have some sense tracking over time how many people utilize the site. I mean, you
Oh,
can
yeah,
tell how many
absolutely.
hits you get.
Yeah, absolutely.
That's good.
Mitch does a really good job of putting in reports for us so we can track who's coming, if they're coming from a mobile device, if they're coming from a desktop, where they're coming. It's great. It's really useful.
Who did
We're
the
the
web
second
page
most
creation? Is that-
visited website through the
Yeah.
city's website. We're the second most visited besides the homepage.
That's great, yeah. Well, that's certainly speaks volumes then for people's interest and need. So good. Anything else on that topic? Well, it's great. Keep us informed going forward. And so you said the soft opening is tonight. So starting tomorrow, most of those links should be live and work. All right, we should all take some time to look at that. All right. The other thing under old business was the health board amendment. Are there any, I know the lawyers were still working on that. We passed a few of them. Is there anything today that we need to address in that regard? Mr. Latchett, do you know if there's anything going on there? Do you
I'm
happen to know,
sorry, what was
Shelley?
the question? I was on the.
Oh, the question was, one of the things still on the agenda was the health board amendment. I know we voted. to
Yeah, no,
change
that, and
some.
that came up
Anything
last
that
week,
we
and I
need to
think that
act
was
on today?
already addressed. I wasn't prepared to talk on it because it was kind of a surprise, but we.
Okay, all right. So we don't have
had
anything that we need to.
discussed
discuss,
the
right?
code itself, I think is fine the way it is.
Okay,
I discussed that with council's solicitor, and then we did a
Okay.
health code amendment, so we're good.
Okay, Fred,
Alright.
just so I'm clear, then we're gonna not amend the health board. We're gonna leave it as is.
Yeah, I think it was a question of the third class city code changed, but we don't have to follow the third class city code on things like this. And I think we prefer to kind of keep it the way it is. I think that was discussed maybe 2 meetings ago, that we like having this type of setup as opposed to a more formal. And then of course there's, what's the county going to do if they have theirs? That would be, we would still want to have something, I think, more of a makeup of a city resident with some medical advisors on the staff.
does anybody know if there's still talks at the county level about starting a county health department? I don't know anything. All right, yeah, well, maybe, I don't know when
I
Dr.
think that- well,
Wang
that-
joins us.
I don't really know directly, but that was discussed yesterday at a meeting, and I think my understanding is there still is some discussion. I don't know at what level.
Yeah, all right. Well, and maybe Dr. Wang will know something about that, because I know they were involving the people from the community health center on some of those discussions. All right, is there any other business for the good of the order before we would entertaining adjourning? All right, well, then I guess we can discuss the next meeting. If we follow our regular schedule, that would be Tuesday, October 3rd. So unless somebody has an objection, let's just keep it where it is. And if, as we get closer to the date, if there's something comes up, we can change something, or something pressing comes up, we need to meet prior to that, we can do that as well. So if nobody else has anything, can I have a motion for adjournment? Come on, we don't want to keep
Motion to
sitting here.
adjourn.
I second.
All right, all in favor? Aye.
Hi.
All right, well, thank you all. Have a nice rest of your summer. Stay away from the heat. Hope we don't get any monsoon rains.
See you at the ice cream social.
Yeah, hopefully we'll make it up there. All
Okay.
right.